Uh, we talked about snail-transmitted helminth, vegetable transmitted helminth, the infective stage of metacercaria for Fasciola hepatica and Dicrosolium dendriticum. Again, we are talking about snail parasitic infections. But this type of parasite is waterborne parasitic infection, not by drinking water, by touching water, by swimming in the water, by going and washing clothes and dishes near the rivers. But be careful, if this sanitation situation, if public health education is aware about such matters and environmental sanitation is good, this cycle of the infection is cut. But we are talking about nearly 2 or 4 million, hundred of people who are living in high-risk areas. For the next one is schistosomiasis. Schistosomiasis caused by schistosoma parasite. I told you that there is just one case in trematodes that males and females are separated. Fasciola hepatica, Dicrosolium, and others, males and females are in the same individual, but this is completely different. We have male schistosoma, we have female schistosoma. Schistosoma hematobium is the agent causing urinary schistosomiasis, bilharziasis. And for other intestinal schistosomiasis like schistosoma mansoni and schistosoma japonicum, and also we have schistosoma intercalatum, schistosoma other cases. They are not so important to talk about them here. I will start with schistosoma hematobium, but I decide to mention all common important points when this is especially belong to hematobium. I will mention it. When this is belong to mansoni and japonicum also, we will talk about that in details. Urinary schistosomiasis, blood flux, schistosoma hematobium, causing agent for bilharziasis, urinary schistosomiasis, schistosoma japonicum, Southeast Asia, schistosoma mansoni, schistosoma intercalatum, and schistosoma mekongii. As you can see here, in the body, throughout the body of male born, we have gynecophoric groove. In the gynecophoric groove, the female is lying over there after copulation, and after they become fertile, they leave the male one and go to the biological, to the special natural habitat of them, and in their natural location, which for bilharzia, for schistosoma hematobium, is around the bladder, along the bladder and urinary tracts. So this is important to take into account for schistosoma hematobium. Again, life cycle. At the life cycle, you can see here that the parasite, for instance, schistosoma hematobium, is lying around the veins of bladder, urinary bladder. The eggs, you can see here, they are terminal spine, where they are packed to each other, after each other. They can penetrate the vein of the bladder, the wall of the bladder, and enter to the lumen of the bladder into the urine. So it means that the eggs are laying out by the patient by urination, okay? So if there is sanitary condition, if they are in good circumstances and in good with health infrastructure, and they have toilet and they have enough they are enough educated to not urine in the environment, okay, so the infection is finished, the transmission. But we are talking about some places and plenty of areas and the wide areas in the endemic one that are in risk of acquiring infection. Okay, the eggs are here, and if the eggs are on the soil, they will be destroyed and finished. And if they are in the water stand near the river or near the river bank or somewhere, they may access to freshwater snails, Bulinus truncatus. Bulinus truncatus, the intermediate host of schistosoma hematobium. They enter to the snail, and some developmental stage happen over there, and thereafter in the final stage, cercaria become released. Cercaria are swimming objects into the water. They do not change to metacercaria. They are swimming. This tail, four-claw circle, they are swimming, and by passing time up to one day they become slowly, and then after, if 48 hours happen and they could not find the host, they become dead. So during this time, if they find the final host, what does it mean? The intact skin of all of us. When we are swimming in the water or we touching in the water, they touch the skin, and the tail is cut, and the head of the circle enter to the subcutaneous, and you can expect that the first acute sign of the patients are itching the skin. So that's transmission. And the infection transmission is like this. And after some days, they enter to the circulatory system, and they go to the veins of the liver, and they become adult. After copulation and after fertilization, they leave each other, and the female one go to the vein of the bladder, and again eggs are produced, and egg to egg is the life cycle of schistosoma hematobium. I prefer to read some of these sentences. Schistosoma hematobium widely distributed over the African continent, with smaller foci in the Middle East, Turkey, and India. Up to now, the cases in Turkey I cannot find, and I could not search through the internet. But honestly, let me tell you that this parasitic infection, according to one of our eminent professors, he is now in the United States, and his book is always refreshed along with his early age, and he believes that the schistosoma hematobium entered to Iran since the Achaemenid dynasty 2,500 years ago, when between Egypt and Iran was a relation, but not good relation, in war, they were in war. And the soldiers from Iran went to Egypt, and when they back to Iran, they brought the schistosoma hematobium by themselves. Even now, the scenario is saying something true. If you go to Egypt now, the infection is current. In Iran, since 2001 till now, no positive case I could find in Iran. But the infection still is current in Iraq. So the only endemic area of Iran was Khuzestan province bordering Iraq. But the first case of schistosoma hematobium discovered nearly 70 years ago in Abadan. But it was an Iraqi worker from Basra. At that time, it was the beginning of the instruction of Abadan refinery, oil refineries factory, and the workers, for instance, from Basra Early morning they came to the refinery, Abadan refinery, and then afternoon went to their house, to the home, and again. So one British physician found this infected people, infected worker in Abadan, and from that time, the School of Public Health, Internal University of Medical Sciences, at that time, they were concerned to look for the other patients in Iran. At that time, they could not find Abadani people or in Khorramshahr any case of infection, but they could find in Desful, in Shush, in southern part of Ahvaz, northern part of Ahvaz, this case of infection. So bilharziasis discovered around nearly 60 years ago in Khuzestan, the only endemic area. Here in northern part, in western, eastern, we could not find even one. It is because of this picture. When we cannot find the intermediate host, there is no news about this matter. Since 2001 till now, we could not find even one positive case. But according to WHO, we cannot receive this certification. Why? Because in Iraq, still we can detect the patients. One Iraqi professor of parasitology from, I forgot the name, from Baghdad University, he was my guest nearly 13 years ago in Khuzestan, and we had a field visit with another one. She was a lady from Al-Amore, and we detect all places in Khuzestan. Unfortunately, she was died because of malignancy. And they found that we found that in some regional, in some bordering area, still in Iraq, the patients are significant. But now we have not any up-to-date information. So I wanted to tell you the scenario, the epidemiological one from the perspective of time. 20 years ago, more than 20 years ago, nearly 40 years ago, sampling in Khuzestan province showed that nearly 40,000 people each year were found infected, but now even one we cannot. So, Schistosoma mansoni, the responsible for intestinal schistosomiasis, widespread in Africa, foci in Middle East, and the only species in the Western Hemisphere in parts of South America and some Caribbean islands. For Schistosoma hematobium, I should add that in Egypt, for instance, at the same time, they have Schistosoma hematobium and Mansoni at the same time. But for Japonicum, it's just for Southeast Asia. For African countries, like Nigeria, for instance, for African countries, like Nigeria, for instance, although both types of these parasites can be detected. This is what you have to know concerning the epidemiological status. For Mekongi, for Intercalatum, Central and West Africa, humans are the main reservoir of infection. For what type? For Schistosoma hematobium. But for Schistosoma japonicum, for instance, you can regard it as the zoonotic one, because dogs, other canines, and all other wild animals can get infection. So, even rodents. 3 eggs of 3 species of Schistosoma. The first one here is Schistosoma, the eggs of Schistosoma mansoni, lateral spine. Terminal spine is for Schistosoma hematobium. And this type, round one with knob, is for Schistosoma japonicum. What about the snails? Purinus truncatus is the freshwater intermediate host for Schistosoma hematobium. Oikomelania is for schistosoma japonicum, and Biomphallaria for schistosoma mansoni. Global status of urinary schistosomiasis. For urinary schistosomiasis, Africa, Middle East, I told you. 53 countries of the African continent and in the Middle East are of endemic areas for urinary schistosomiasis. 53 countries. The number of people residing in these are estimated about 779 million people. This is why, according to WHO, schistosomiasis is a neglected one. Referring to the point that he mentioned, we cannot ask the governments, okay, deal with these millions of people at risk. Please sanitize your country. With what amount of money? Who can provide this budget? So this is neglected tropical disease, neglected tropical parasitic infection. So we have to make the governments concerned about this important matter to try for that. In Iran, after 40 years of combating against schistosomiasis, fortunately, our country and our professors were very interested to do that, and now we have not any one case. In Iraq also, I'm sure that the cases are not like the 20 years ago. They must be very few, but I have not any recent and update information. Okay, this is the yellow one is for urinary schistosomiasis. You can see in Morocco and in Egypt, in Africa, the scenario is something else. From Morocco, I'm sure that the disease is eliminated and certification from WHO has been issued. For Egypt, no. And in Iran and Iraq, although all the territory of Iran is yellow here, but the endemic area is just in Khuzestan province, southwestern Iran, and Iraq as well. So, I'm very interested to show some pictures to you and ask you what is your answer to this question. Maybe I show you a jungle and I ask you, okay, ladies and gentlemen, what type of parasitic infection can be transmitted in this area? Jungle. This is Arctic. This is North Pole or South Pole. I'll show you icy mountain, and I ask you which type of infection can be acquired in this area. And specifically for this picture. I will show you this picture, okay, and ask you which type of infection can be transmitted here, and we have to concern about that. Look at here, water. Plants, places to get snails, warm weather, people in the water for swimming, and they are not white in color with blue eyes. They are African. Again, we cannot ask them, okay, when you want to urination, come out and go to that toilet and then after come to here. So it means that all condition is ready. By this we can see that, we can tell you that schistosomiasis must be transmitted here. Okay, which type of other infections, I will ask you, I would like to ask you, which type of other infection can come to your mind by seeing at this picture, by watching this? No. No.
Cholera?
While looking at this picture, this is from Africa. Which type of infection comes to your mind that attracts your attention? In this picture. Yes, why not? Yes, yes. But not related to the water, because they are okay.
Coronavirus. Coronavirus.
Coronavirus is everywhere in the United States, in England, in everywhere. Wherever they are, even shaking hand was prohibited. Okay. The other. This is for parasitic infection. And what about bacterial one?
I say that malaria.
No.
I say cholera. Cholera.
Yes, exactly. After all talking, it was the best. Okay. No, cholera, Vibrio cholera. Vibrio cholera also can be expected in this situation. But we are parasitologists and we are talking about schistosomiasis. This is very important. Just I want to attract your attention for describing pictorial description. Okay, these pictures are from Iran. This is dam of Dez. In the book you can read that in Egypt, when the Osman Dam was constructed, the prevalence of schistosomiasis was increased. This is area around Khuzestan, bordering Iraq. But nowadays, the raining rate is not so that we can show you these pictures. Anyhow, in these places near northern part of Ahvaz and also in some parts of Susanger and Bostan area, and this is the river near the Spul, and also this is for Shushtar. This is a pictorial, this is a historical irrigation system of 2,000 years ago till now. But the important is that by these pictures, you can see, you can guess that schistosomiasis can be prevalent or can be endemic here. If a patient comes from Iraq, comes from Khuzestan, and go to, for instance, Rasht, and the eggs in the urine of the patients are in the water, this is not dangerous. Why? Because the Bulinus truncatus cannot stay over there. Maybe you bring the Bulinus truncatus from southern part to northern part. Okay, you are going to perform what does it mean? It was biological terrorism, yeah, like that. Okay, but fortunately, the snails cannot resist over there. 1 month, 2 months later on, the generation becomes stop, and you cannot see the in the next year after the very cold winter season to find again Bulinus truncatus. This is the picture that you can guess and you can explain and describe the health status in one condition, in one area. Okay, what does it mean? It means that if sanitary construction, if toilets become ready, if the people become aware about the infection transmission and snail control become happen, okay, the life cycle of parasitic infection, specifically schistosomiasis, will stop. Here, they are here for drinking water to their home. You cannot, okay, for not to get bilharziasis, please avoid touch water. How can I resist? How can I live? How can I clean my body, clean our dishes? When I was a child, I remember that at that time in some cities and towns, the mother were near the canals and near the rivers to wash our clothes. Now, if you see such scenario, It's very unusual because they have all machines in their home or houses, and also the pools, the sanitary condition in hotels and somewhere is something satisfying for you to help not get infection. So, and again, irrigation system, when is engineered and the surface of the canals are enough soft not to get another objects to collect snails, this is also good. And this is from Susa. Susa, it's very good. And also the Shahur river was the main source of collecting snails over there at that time, and nearly thousands of people were seen infected on that time. Okay. Pathology of schistosoma hematobium schistosomiasis includes hematuria. When the eggs penetrate the bladder wall and enter, and veins over there, and enter to the urinary bladder, microhematuria can be expected. But this is not in the acute phase. Acute phase was itching, called as swimmer's itch. Why I am itching? Explain, tell me what was happened just from yesterday till now. Oh, just I was swimming over there. Okay, now itching. This is the acute phase. And then after, some days after all, some weeks after all, you may see that fever, restlessness, and pain in the body is witnessed, and then after weeks and months after that, you may have hematuria, and this is due to eggs penetrated the intestine, the bladder wall. So you can see here that scarring, calcification, squamous cell carcinoma, which is very bad consequences. So by residing the eggs inside the urinary bladder, and reinfection after reinfection, and due to the longevity of these worms, the lifespan of the worms are nearly 30 years. So 30 years they are over there, and you are in the endemic area that's at risk of reinfection for several times. So it means that when somebody around the age of 40 are living in Khuzestan at that time, and in Iraq, in endemic areas, or some places in Egypt and somewhere, and they have been faced to this infection for several times, and maybe they are at risk of squamous cell carcinoma. This is very important. I'm looking for a project for PhD students. I asked for archive of pathology in these areas to receive the organectomy archive and the bladders over there if they diagnosed as malignancy, and I try to extract DNA from these materials to reconfirm whether the cause of this malignancy had been labeled as schistosomiasis or not. This is very important for research. Okay, and about intestinal one. Acute symptoms are dermatitis, first one, followed several weeks later by fever, chills, nausea, abdominal pain, diarrhea, meningitis, and malaria. Chronic symptoms vary with species but include bloody diarrhea for schistosoma mansoni and schistosoma japonicum. Okay? But for schistosoma and mekongai and intercalatum. For schistosoma hematobium, we expect for hematuria. Okay? Diagnosis is by identifying eggs in a stool for Manzoni and for Japonicum intercalatum. And for hematobium, we have to look parasite within the urine sample. And for intestinal schistosomiasis, again, early on, intestinal mucosal ulceration caused by these types of schistosomes may bleed and result in bloody diarrhea. So after that, we can see here that it causes fibrosis and cirrhosis in liver, which can lead to portal hypertension, resulting in splenomegaly and esophageal worries. Esophageal worries may bleed, causing hematuria. This is very important to just remember the difference between intestinal schistosomiasis and bilharziasis for schistosoma hematobium. For schistosoma Manzoni, the adult lives in the blood vessel mesenteric vein. Okay, the eggs enter to the intestine, and also for this is not something. The size is around 2-3 centimeter for schistosoma hematobium, but for Manzoni a bit nearly 1 centimeter, and the eggs are lateral spine. For schistosoma japonicum, zoonosis, okay, Far East, China, Philippines, Indonesia, and Southern Asia. And yes, I was a paper I was reading. I was reading with my students last week for schistosoma Manzoni, and they found that a very famous Arab singer was died due to schistosoma hematobium. Do you know who was the very famous Arab singer? Egypt singer? Egypt singer.
His name? His name?
He is died now. Abdul Halim. Abdul Halim Hafiz was died due to schistosoma Manzoni. Just last week I informed about that, because I thought that he was died due to malignancy. But a paper, I was looking for writing another paper, and I found that schistosoma Manzoni was the cause of this death. Anyhow, this is just to look very wide around yourself, and you have not to look on the case in a tube. You have to have eye vision when you are looking for.
Due to schistosoma japonicum?
Manzoni. Because in Egypt, Manzoni and schistosoma hematobium at the same time are the cause of suffering people. Anyhow, the important is that schistosoma japonicum live in the mesenteric vein like Manzoni, okay, and exert eggs that circulate to the liver and colon. The eggs migrate through the intestinal wall and pass out with the stool. This is for japonicum and for schistosoma Manzoni as well. Okay. About this picture, I remember when I started my work in southern part of Iran, near bordering Iraq. Each week we had to go to the villages to get urine sample and back to our laboratory for finding eggs. Among 200 samples for each round of sampling, at least 40 people were found infected. 40 samples were found with schistosoma hematobium eggs. This is when the health worker go to African villages and African cities, suburbs, to find the infection. Okay, they ask the school children, okay, urine sample, and they can detect the eggs. I remember that with Coca-Cola and Pepsi-Cola, some of our professors went to the religious area, and they gave to the students notebooks and I don't know, magic or something for writing as a gift. and then after Coca-Cola and Pepsi-Cola to eating and to drinking, and after 2 hours later, they ask the manager of the school to ask the students come and to get the urine sample, and it was the best way. Do you know why? Because these in the school children, the chance of infection is much higher than the adult one. You cannot see that the old men like me go to the river to swim, for instance. And seeing the school children, people around the age group, I mean, into the canals and somewhere is very common. So this is for that. And for diagnosis, as I told you, you have to see the particle and tracking of parasites. Although serological test is available and PCR also can design for such infections, but for accuracy and for become confident, you have to find the eggs. Urine sample, sedimentation, and the size of the eggs are very large, fortunately. They are around 140 micron, 160 micron. So even without microscope, with binocular, you can detect the eggs in the urine sample. So antibodies and or antigen detected on blood or urine also is practical. We have rapid test of CCA, I think, yes, circulating cathodic antigen. With a rapid test, you can test and you can find the antigen of the parasite and label that as infected person. For bilharziasis, also unit test I mentioned about that, time of sampling between 10 to 12 is good, around lunchtime. The sampling time for urinary schistosomiasis. Treatment, praziquantel, 13 milligram per kg, 3 times a day, 3 days, 100% effective for treatment. Praziquantel for urinary schistosomiasis. Control measures. I will ask one of you please, you. If I ask you, according to the pictures I showed you, okay, the control measure for schistosomiasis, schistosoma hematobium, you can see, you can tell me one of them? Control measures for schistosoma hematobium. Eating vegetable, raw vegetable?
No.
Who is agree with me eating vegetable?
No.
Pork meat. Eating pork meat.
No.
Shaking hands.
No.
Itching head.
No.
Yes. One of the control measures. Control measures for schistosoma hematobium according to the pictures I showed you. According to the life cycle I told you.
We should to control the snail.
First one, snail control. What? This is here, live, snail control. Vulnus truncatus is, for instance, is here in this water stand in this river. If the river is going to 100 kilometers south or east or west, you have to screen that. Or in the endemic areas when the prevalence was high, molluscicide was using over there. Okay, this is one. The other one?
Hygiene education. Yeah, what he said, hygiene education.
Hygiene different in general?
No, only.
Okay, brush your teeth.
No, just in the matter of sanitation, going to the toilet like that type of hygiene.
Making I mean the infrastructure, having toilets,
Yes.
available toilets
Yes.
around, yes. And the other one, which is much important.
Clean water.
Avoiding dirty water.
You mean it's better to educate, health education. To health education. If you get together all the villagers, okay, and you explain about them that hematuria is when you go to the toilet and you see that your urine is bloody, okay, you are infected with this parasite, so this is very dangerous. Maybe malignancy is consequence of this infection in chronic phase. So it's better to avoid urination, water into river. Yes, okay. It's better to avoid your children go near the rivers, and as they are not well identified, healthy, or according to your, pay attention to your health workers, they are with you. This is very important. So the control measures here: access to safe water, improved sanitation, hygiene, education, snail control. This picture is for Iran. This is for Iran, and this is for African countries. Okay. Finished. Schistosoma hematobium finished. If a good question concerning schistosoma hematobium and what I told you about this infection, it is like you get a good mark in your exam. I'm ready for question before entering to the next session, to the next subject. Otherwise, I will ask you a question.
Why doesn't the hematosis one go to the bloodstream itself and cause intestinal?
What?
Schizophrenia, hematosis?
Mansoni.
Yeah, no, not the Mansoni. The
Japanese.
hematosis.
Hematobium.
What's hematobium? Why doesn't it spread to intestine?
You see, for each parasite we have tendency. For each parasite, we have to say that they select their own natural habitat. Okay, this is after this. For Schistosoma hematobium, vein of around the urinary bladder. For Japonicum and Mansoni is mesenteric vein and intestinal tract. Okay.
You said that schistosoma can live in water for a bit, right? Why do we
Eggs.
The eggs. Why do we never see fish as reservoirs like pigs?
Tendency, because the parasite, although if the freshwater fishes can eat the eggs, but the biology of parasite is not something to develop in fish.
Just in
Yes?
snails. Just
The
in
intermediate host or chronic?
Just in snails, not in fishes.
Just in a snail, just in a specific species of snail. Bulinus truncatus for Schistosoma hematobium, tiny one.
Is it a tiny snail?
Yes, this is not something that you can eat them. For Schistosoma mansoni, Biomphalaria, discoid one, and for Schistosoma japonicum, Oncomellaria.
Are they also large?
The largest one are less than 1 centimeter.
So they cannot be eaten.
Yes, no, they are not edible. They are something to live around the water states. But fortunately, please, concerning the biological environment of Schistosoma hematobium, I can say that they are the good index for good waters, for good water area. When you find Bulinus truncatus, it means that the water is clean, not chemical matters, not near to the sewage areas. Do you know why? Because if the sewage system is going to the water, you cannot find the Schistosoma hematobium. They are very good creatures to find the intact and healthy waters. This is very important.
So can we find them in, for example, England?
Yes, in England, no. The most important factor for having such creatures is the thermic and the appropriate climatological factor. You can bring these snails from Uzbekistan to, for instance, to I don't know, Azerbaijan, okay, Tabriz, in very good waterland place, but they cannot resist over there. Although they can resist up to summertime, but by entering to the autumn and winter, they become died, and then after they cannot breathe over there.
What about birds?
No, birds, yes. Birds can get these snails when they are drinking water, near the water. And I saw one example, thank you. I saw one example in when I, nearly 20 years ago, we received a report that, okay, in Bandar Anzali, we detected, one of my friends, we detected Bulinus truncatus. We went over there with other specialists over there, and we decided to find, and we found some species of eggshell of Bulinus, but dried and near the 10 centimeter of sands over there, and we could guess that it must be brought over there from Khuzestan province by migratory birds, but they cannot stay over there and they cannot resist for years. Okay, let me ask another question. I will ask you to avoid you become so far from the class. Okay, first, I told you about schistosoma hematobium. Where is the location of the adult worms? Schistosoma hematobium, the adult worms. The adult worms of schistosoma hematobium in the body of final host. No, the adult worms, the living place of adult worms of schistosoma hematobium in the final host. Snails are intermediate hosts. The eggs are in the urinary. No, this is before schistosoma, mansoni, and japonicum. In the liver, yes. In the liver, they stay over there, and the female one, after that, they migrate to the vein around the urinary bladder and stay over. Thank you.
So I can answer your question. I can answer the question.
Yes.
The what's it called is the final place for the adult form is you mean humans and rodents and horses and pigs, correct?
It was for the schistosoma japonicum, not for hematobium.
Humans only for
Hematobium is the final host is just only humans.
It's chronic in humans and intermediate in snails.
Chronic?
Yeah?
Chronic
Or
and
still-
no. You see here, no.
It lasts for 3 days, so intermediate.
You see here. This is human,
Yes.
okay?
Yes.
We have in human acute phase and chronic phase. Acute phase is swimmer itching the skin. When they touch the polluted water. Okay, for some days. And then after, they leave the skin, go to the circulatory system, up to reaching to the liver, okay? During this second phase, they may face to fever, chill, and something, okay? And it takes time up to they become adult and laying eggs by the female around the veins of in schistosoma hematobium urinary bladder. So 2-3 months, 6 months, even 1 year after itching, you may face hematuria. And for chronic phase, When it is after hematuria and like that, maybe you may have deal with malignancy, squamous cell carcinoma that I told you. In Iran we could not find, but in Egypt, yes.
So does it also go to the liver? Does it also go to the liver?
You mean the no, the adult one?
Yes.
Yes, the adult one stay into, for instance, in one common period, and they stay over there, and then after the females migrate to the.
Are they limited in rivers, or we can see them in the seas?
Please again.
Are they limited in rivers only, or we can see them in Kish seas?
No, they are tendency to fresh waters. If you can drink the water of Kish, yes, they can stay. Okay, so this is for the last part of this session. You are talking with each other, thank you.
No, we've been just discussing this.
Well, not always, but
Yeah.
you disturb me to ask a question.
We're sorry about that. But
Yes,
we had
okay.
down
Let's
here-
continue. For three other rare helminth infection, not rare infection in Southeast Asia. This is common, this is prevalent in Southeast Asia. We are talking about rare parasitic infection in our region. I mean in Iran, in Iraq, in Pakistan, in nearly Afghanistan, in Turkey, and somewhere bordering Iraq. Okay? So, Clonorchis sinensis, liver fluke again,
Chinese.
very small in size, nearly 4 millimeter in size, very, very less than 1 centimeter, around 1 centimeter. Okay? The normal location is bladder is biliary tract, in gallbladder, they are and the longevity and the lifespan is very high. It's very wide, nearly 30 years. So when you are facing to one worm with 30 years lifespan and excretory secretory system in biliary tract, you may expect that even lithiasis is happening over there, and even by confronting such scenario, you may expect malignancy in liver and gallbladder. So, Clonorchis sinensis, brief introduction to this parasite, oriental liver fluke, foodborne parasite. In the picture of the life cycle, you can see 6.1 million people are currently at risk. 570 million of which live in China and Taiwan.
Chinese.
Okay? An estimated 30 million people are infected with Clonorchis sinensis. Here in host, definitive and intermediate host. For intermediate host, snails again. Again snails, freshwater snails. Paraphosarus. And here we have two intermediate hosts, fish and snail. 12 species of fish are capable of passing the infection to human. So, definitive, fish-eating mammals and accidentally humans, not accidentally, routine, or those who are preferring to eat sushi, for instance, undercooked, well undercooked meat and fish and something. So, this is very important parasite. Liver fluke, Clonorchis sinensis, oriental liver fluke, Chinese liver fluke, oriental liver fluke, okay? Lifespan is 20 to 30 years. These words and these sentences are something to inform you about the basic matter related with this infection. For instance, if somebody asks you, I am vegetarian. I am vegetarian. You are not well informed and well, I don't know, educated to ask them, to ask me, is the cause of this claim of the patient is Clonorchis sinensis or trichinosis, for instance? No, he or she is vegetarian. The eggs like this, again, operculate, and the life cycle you can see here. They are living in the gallbladder. Eggs are through feces in outside, and then after miracidia, the embryo of the eggs hatches from the egg and enter to the body of the snail, and these stages is ready and cercaria, and then after cercaria comes out into the water and they enter to the body of fish. Not the fishes are going to eat them. The metacercaria, the cercaria go into the skin and the muscle of the fish and they stay over there. And metacercaria, the infective stage to transmit infection to humans and to fish-eating mammals is infected fish with metacercaria. When you get it, if we boil the meat like what we are cooking in Kurdistan, for example, qalya mahi. Qalya mahi is not something to transmit clonorchiasis or fresh or fish-borne parasitic infection, because enough boiling temperature over there do not permit the allow the metacercaria to be exist, to be alive. But in sushi, when undercooked fish is eaten, you are at risk to acquire infection. This is what is important in this Oriental liver flu. Over 30 million, yes. Okay, China, Japan, Korea, Vietnam. Transmission route, source of infection, patients infected, reservoir host, cats, dogs, mice, and pigs. So humans and other fish-eating mammals are same in the way of acquiring infection. The infection is acquired by eating raw or inadequately cooked freshwater fish or shrimp in China, for instance, or in Philippines, shrimp. Susceptibility. Human is generally susceptible related with the dietary habits. Okay. Yes, 100 species of freshwater fish. Even I talked about the other animals who can get infection, and also, yes, there is nothing to.
Before it was written 12 species of fish.
What?
On the first slide it was written 12 species of fish. Now it's 100.
No. The host range is broad. The host range. The host rates are broad. Multiple species of snails and more than 100 species of freshwater fish as intermediate host. Snail and fish are intermediate hosts. First intermediate host, snails. Second intermediate host, fish.
The fish isn't infected itself, right?
Yes.
It's infected
By what?
by
By cercaria, yes, not by eating that. The cercaria enters into the skin and to the body of the fish.
So the fish can die. No. Why?
I don't know what it's
No, she's asking like, will the fish die itself? Will the fish be infected itself? Like how we would do that? No, right?
No, when you get fish to eat the fish, when you get,
What if the fish eats the fish? Like the big fish eats the small fish?
I don't know the species of fish. It could be like this, it could be like this.
Yeah.
But no, I'm talking about freshwater fish. Freshwater fishes are not something like this size. Freshwater fish is maximum in such size, like gazelle, for instance, in this part of Europe, in the northern part of Iran, in other parts except in Khuzestan province. So the important is that your question and your imagination must be a bit legal for that. The freshwater fishes.
It's in the slide. On the credit.
What is it? Fish. Second, intermediate host. 12 species of fish are capable of passing the infection to humans. It means that if the humans ingest the infected muscle of this fish, yes, but not if they are enough cooked and boiled. Undercooked, infected muscle of the fish. Okay?
Excuse me. When we say first and second intermediate host, so firstly the eggs.
No, first is the snails.
Yes, the eggs though are go to
The
the
eggs,
snail.
no, the Miracidium become out. Miracidium go into the snails.
Infects the snail.
Okay, and Cercaria release.
Eggs.
No, Cercaria release
Oh, it's released.
from.
Goes to the fish, which are the second intermediate host.
Yes,
And then these fish infect us.
exactly.
So in this slide, there are 100 fish which are intermediate hosts. Are they first or second?
No, second. All of them, if they are 1,000, are second. If they are 1 million types of fish in terms of transmitting tuberculosis, okay, they must be regarded as second intermediate host. Okay, so you see here, shrimp in China, even shrimp in China, they found infected, not as first intermediate host, second, because they transmit infection to us. Okay. Clinical presentation, worm burden is very important. How many worms are in your body, in the dead body of the patient? Clinical manifestation, inflammation, obstruction of the biliary ducts, worms feeding on mucosal tissue, toxic effects, and something that can be lead to cholangitis, cholelithiasis, and cholecystic, and also cholangiocarcinoma in very worsened condition. For pathogenesis, worms, mechanical stimulation, this is not something I talked about. For pathology, also associated with cholangiocarcinoma, this liver fluke, and again, praziquantel, 25 milligram per kg, 3 times a day for 2 days, and no more. And again, for diagnosis, you have to look for eggs, stool examination, and I'm sure that in South Korea, for instance, one of our friend, Dr. Sung Tae-hoon from South Korea, he was in Tehran and talking, he delivered a very good lecture and described the serological test for diagnosis, and also when I was over there, he brought me to a center which the specialists were looking for if they can find another new place to breed some infected fishes over there. I remember I was in a congress in England in 2006, I think, and we were invited for dinner, and some all from the all countries, the parasitologists were attending over there, and a Japanese parasitologist Yamasaki, very nice man. Sushi was over there on the table, and one of the Spanish professor, Dr. Mascoma, asked them, okay, Yamasaki, don't touch this. This is sushi, and we're afraid to get chronichiasis or opisthothiasis. And can you guess what was the answer of this Japanese parasitologist?
You can eat it.
No.
He eat it.
No. The answer. What was the answer? The answer was, okay, first of all, we are Japanese, then after parasitologists. So this is something to be, first of all, we are Japanese, we cannot avoid eating sushi, and then after, if we get infected, we can come to you and ask for treatment. Okay, the next one is Opisthorchis felineus, causing opisthorchiasis. Cat liver fluke. Parasite disease caused by Cercarius or Opisthorchis, I don't know, that's what, this is the size of the worm, is smaller than chloroquine sinuses, and the picture says what we need to understand about this infection. Biliary tract, gallbladder, feces, snail, miracidium, in the snail, Cercaria form metacercaria in fish like chronichiasis, and humans and fish-eating mammals can be infected by ingestion the metacercaria. Okay, here, look at here. Symptoms of opisthorchiasis are indistinguishable from chronichiasis. And then after here, the adult flukes around 7 millimeter to 12 millimeter in biliary tract and gallbladder. And also after ingestion, the metacercaria exist in the duodenum and ascend to the ampulla of water, like what I talked about the other trematodes except fasciola hepatica. So, this is the last one. And why I like to describe it a bit for you better, because you can find this parasitic infection in Iran and in Iraq. Fish-eating parasitic infection. Fish-borne parasitic infection by eating fish. Not fish in the sea. Not fish of salty water. Fish of freshwater fishes. In Khuzestan province, if you go there in Susangerd, in northern Ahvaz, and in some places near bordering Iraq, you can find nearly 2, 3, or 5 species of freshwater fish that they are capable to get infection and transmit infection. But the important is that the style of cooking of those fishes are something dangerous, because the people decide to make kebab with this fish, and the juicy one. One of the species of this fish is benni. Benni fish, very delicious one, and now it is very expensive, I guess. But in Khuzestan province, when you go to Arab villages near the Susangerd, and you can see that the women are selling the fish, and they cutting and cleaning and getting, okay? So, very important is that acquired infection is not just due to eating fish. Maybe you go to a family, and you find a patient, and you can see that she says to you, yes, they say that you get this infection from eating fish, but I never eat fish. I never eat fish. But she cleaned the fish. Through cleaning in the chef, in the, I don't know, in when they want to make food, okay? The woman, the mother are cleaning, and the metacercaria is attaching to the skin, and maybe they pass it to the mouth and they become infected. But this is the general, I wanted to emphasize on that. What is a parasite? Heterophyes, heterophyes. Heterophyes, heterophyes, and causing heterophiasis. The size is very small, nearly 2 millimeters, the adult worm. Guess how the eggs of this parasite is still very small, nearly 20 micron. The technicians in the laboratory cannot detect this very easily. So be careful. Maybe you see a patient with diarrhea, with abdominal pain for some days, but nobody can diagnose what is the cause of infection. Why? Because the clinical symptoms of this infection is similar, indistinguishable from other even bacterial infection. So this is very important. And what is very dangerous for this infection is not just this diarrhea, because the size of the worm is very small. The size of the worm is very small, and by oral sucker they attach themselves to the intestinal wall. And if the number of the worms are few, 5, 6, 7, okay, this very small 2 millimeter worm cannot produce very dangerous signs and symptoms. But the most important one is circulating of their eggs, because their eggs with 20 micron can go through the blood circulation and produce some, I don't know, let me tell you that, for instance, myocarditis in Philippines, they believe that 30% of myocarditis can be happen due to heterophyes over there. So this is why we have to be conscious about this infection. In Khuzestan province, since 40 years ago till now, our professors described this infection, and one of my friends, his thesis was for schistosoma, for heterophyes. Nearly 6% of villagers in that area he found infected. And this is the zoonotic one, because all fish-eating birds, fish-eating mammals can be found infected. Some years ago, I was driving between Ahvaz to Susangerd, and I found a carcass of cat killed through the road. I brought it to the laboratory and dissected, and I found heterophyes worm inside the intestinal tract of that cat. What does it mean? It means that the, I don't know, the portion of the infected fish could be ingested by that cat. So it means that the fish is over there, the fish is infected, and when you can find the cat infected with this parasite, finding the people over there infected also is expected. So this is heterophyes, and nothing more than for intermediate host. The eggs, this is intestinal fluke into the small intestine, eggs through the feces out, and then after eggs into the water, Miracidia, and then after go to the snail intermediate host. It is a bit larger than other snails. the type of Melanoides and Melanopsis snail, freshwater snails are plenty in that area. And when the cercaria become released from the snails, they enter to the skin and the muscle of the fishes, and they make them infected with metacercaria, and we can ingest if the fish is undercooked. Yes, that's all. So, this is 12, okay?